Good, happy Saturday morning, September 18, 2021. I'm Riley King. Welcome to this Saturday morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Saturday morning, so let's get started right now. First up, Health Commissioner confronts lawmakers over misinformation as Republicans table COVID-19 vaccination funds. Let's take a listen to that video from WMUR News 9.
In times like these, we're all spending more time with family and more time working our land.
Fearing they could somehow be coerced into supporting the Biden administration's proposed COVID-19 vaccine mandate on businesses, Republican lawmakers on the Fiscal Committee tabled $27 million in federal funds to boost vaccination efforts. Committee Chairman Representative Ken Weiler, a Kingston Republican, wants more information, and he tells News 9 he's expecting to hear reports of adverse effects of the vaccine.
In 2 weeks, if we've heard such a large report of adverse effects, I think we should cancel this because, as I said, is there anyone in New Hampshire who hasn't had the opportunity to get the shot who wanted it? I don't think so. Why do we need to put 15 more people on the street to go around and take your name and knock on your door, interfere with your life to say, why haven't you had the shot?
At this hearing, HHS Commissioner Lori Shivenett told Representative Weiler he was spreading misinformation when he questioned the state statistics that 90% of hospitalized COVID patients in New Hampshire are unvaccinated.
That is in doubt.
Well, it's not in doubt by the healthcare community.
Well, people I'm hearing from that are working in emergency rooms saying that 90% of those admitted have had the shot.
That is incorrect, and that's misinformation.
Why would someone say that?
I have no idea why someone would say that, but that is incorrect. And that is the problem that we are having. Increasing our vaccination rate is spreading misinformation about the COVID vaccine.
Democrats say Republicans are playing with fire.
For us to then not give the department and the experts the tools they need to contain this pandemic is not only really dangerous for public health, but it's really dangerous for the economy as well.
Tonight, Governor Chris Sununu is weighing in and backing his commissioner, saying, quote, as elected officials, we must hold ourselves to the highest standards, and we absolutely cannot contribute to the spread of misinformation. It is dangerous and wrong. I fully support Commissioner Shivenett and the department's position in utilizing these funds. Live in Concord tonight, Adam Sexton, WMUR News.
Okay, and there you go on that video and that report. Partisan divided over Biden vaccine testing mandates widens at the New Hampshire State House. Let's take a listen to that video from WMUR News 9.
Are you looking for a rewarding career with purpose? Join our dynamic team that's dedicated to making a difference. Bring your talent to Riverbend Community Mental Health. Specialized behavioral health by providers who truly care.
The state's Health and Human Services Commissioner fed up with misinformation and fighting back at today's hearing. The governor backing her up while also supporting a potential lawsuit against the federal vaccine mandate. $27 million in federal funds to boost vaccine efforts in New Hampshire on hold. Republicans on the fiscal committee fearing they could be coerced into supporting the Biden administration's new mandate that businesses with more than 100 employees require vaccinations or regular testing. Committee Chair Ken Weiler questioned DHHS Commissioner Lori Shibinette about statistics showing 90% of hospitalized COVID patients are unvaccinated.
That is in doubt.
Well, it's not in doubt by the healthcare community.
Well, people I'm hearing from that are working in emergency rooms saying that 90% of those admitted have had the shot.
That is incorrect, and that's misinformation.
Why would someone say that?
I have no idea why someone would say that, but that is incorrect. And that is the problem that we are having. Increasing our vaccination rate is spreading misinformation about the COVID vaccine.
Governor Sununu issued a statement supporting the commissioner and using the federal funds, saying, as elected officials, we must hold ourselves to the highest standards and we absolutely cannot contribute to the spread of misinformation. It is dangerous and wrong. The governor also supports New Hampshire's Attorney General, signing onto a letter with 23 other states threatening legal action over the vaccine mandate. John Formella tells WMUR political reporter John DeStaso it's not about the vaccine being effective.
I myself am vaccinated, and I personally think it's a good idea for everybody to be vaccinated. But this is really about whether the action that the Biden administration proposes to take is legal. If the federal government can promulgate regulations that regulate the general health and safety of the population, the federal government can do almost anything.
And for John DeStaso's full story on his interview with the Attorney General, visit the politics page at WMUR.com. Live in the studio tonight, Gene Mackin, WMUR News 9.
Okay, and there you go on that video and that report. COVID-19 cases rise again in New Hampshire as 5 more deaths announced. Let's take a listen to that video from WMUR News 9.
Now's the time to get a great deal on taking care of your property. You need the #1 rated reliability of...
But first, a look at the pandemic in New Hampshire. There are 388 new confirmed cases tonight, with active infections going up to 4,100. That's the most since February 1st. 5 more Granite Staters have died. Current hospitalizations dropped to 122.
Okay, and there you go on that video and that report. COVID-19 patients trend younger, unvaccinated in New Hampshire hospitals. Let's take a listen to that video from WMUR News 9.
In times like these, we're all spending more time with family and more time working.
As child COVID case numbers spike, the Children's Hospital at Dartmouth has not seen a marked increase in pediatric critical care. Most children admitted with COVID have had mild to moderate respiratory symptoms or fever and dehydration. The same at Elliott Hospital, but the situation is being monitored closely.
There are very few children's beds across New England versus adult beds, which is since the fact they don't usually require hospital-level care.
But the overall ages of those hospitalized are younger, more under 60 than over.
Of our COVID-19 hospitalized patients currently at CMC, 75% of them are between age 30 and 50.
Another commonality?
The people who are in our hospital or in sick right now are overwhelmingly unvaccinated,
putting pressure on an already strained system.
We used to get a couple of transfer requests a day, and we probably get on the order of 10 to 12 from as far away as Connecticut.
Because of staffing, it has been difficult to have the doors as open to transfers from other facilities as we have at other waves and other points in this pandemic.
Now, the hospital leaders point out, they drive home the point that increasing the vaccination rate not only helps and protects an individual and their family, but helps the health of the entire system. Reporting Jennifer Compton, WMUR News Now.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. Thank you for joining us for this morning edition of the Riley King Newscast. Goodbye, everyone.